most common cancer in our country, even when we combine both genders, is breast cancer. Almost 13.5% of all cancers is only breast cancer. What can you do to prevent it and diagnose it on time? Dr. Dhyaneshwar, who is our medical oncologist, will discuss this.
So early detection of cancer, we can start screening at the age of 20 by doing self-breast examination monthly once. From 30 onwards, clinical examination done by doctors. From 40 onwards, a simple test like bilateral mammogram. In high-risk people like family history of cancers or family history of multiple cancers, they can meet doctors, particularly oncologists, and they can undergo MRI breast also.
Head and neck cancer is a very unique subset of cancer, especially in South Asian population, often related to tobacco, chewed tobacco, and of course when you add tobacco and alcohol. And this number also seems to be rising. And what can we do about it? How can you detect it early? How can you prevent it? Dr. Sharath, who is the head of the Department of Surgical Oncology, will discuss about this.
Talking about head and neck cancer, this is the second most common cancer in the Indian population. The important point in preventing head and neck cancer is to abstain from consumption of tobacco, either smoked or non-smoked, and also abstaining from consuming alcohol. If it is detected early, it lends itself to a high cure rates. So it is important for those habituated to consuming tobacco and alcohol, or even any patient or otherwise, to come for an early consultation and screening if they notice any oral ulcer or any throat related symptoms are persistent or recurrent, or if they have any swelling in the neck.
Self-oral examination also has a lot of importance.
Yes.
In which you could possibly just stand in front of a mirror, in front of a bright light, and just examine your oral cavity and your neck as well.
Yes.
Well, gynecological cancers are the third largest group of cancers in our country. The common cancers being cervix cancer, which is a common cancer in rural India, and second most emerging cause of gynecological cancer being uterus cancer or endometrial cancer, and of course ovarian cancer. All these three are very important, and Dr. Shweta, our radiation oncologist, will be discussing about it. Dr. Shweta, what are the type of cancers and what can we do to prevent it and detect them early?
Cervical cancer is preventable. We have a vaccine for that, HPV vaccine, administered from 9 years to 45 years. And there also a screening test called pap smear, which is recommended from 21 years female, and also HPV co-DNA test, which is usually recommended from 30 years. Coming to the endometrial and ovarian cancers, mainly lifestyle modifications will help to decrease the incidence of these diseases. And there are mainly in high-risk individuals, ultrasound abdomen and pelvis and certain tumor markers like CA125 will help to detect the disease at an early stage.
Lung cancer also is an important challenge across the globe, being one of the most common cancer amongst men and women combined, and a leading cause of death in our country. Dr. Sonali, our radiation oncologist, will tell us what we can do to diagnose it on time.
There are various risk factors causing lung cancer, like most common is smoking, first-hand smoking, second-hand smoking. Other than that, the other risk factors are radon gas exposure, occupational hazards. The easiest way to prevent lung cancer is to avoid smoking and use of occupational gears. Screening guidelines for lung cancer is individuals from about the age of 50 up to the age of 80, and former smokers or current smokers, former smokers up to the age of with smoking history of 15 years should do a low dose CT scan per year, at least annually once, and if any mass or is discrepancy is seen on the low dose CT, we'll have to investigate further about it.
Fifth commonest group of cancers in India includes gastrointestinal cancers. These are a group of cancers which include food pipe cancer, which is the esophagus, stomach, the small intestine, large intestine, and the last part, that is the rectum and the anus. Dr. Venkatesh Babu, our surgical oncologist, will tell us more about them.
For colorectal carcinomas, those who are average risk, that means there is no increased risk or there is no positive family history, we can do either one of the following starting at 50 years of age. That is either stool for occult blood starting at 50 years of age annually, or sigmoidoscopy every 5 years, or colonoscopy every 10 years. Those who are at increased risk of developing colorectal carcinoma, that means those with positive family history of familial adenomatous polyposis, we start screening at 10 to 12 years and we do colonoscopy every year. And for the patients with positive family history of HNPCC, we start screening at 20 to 25 years that is also every year we have to do colonoscopy. And for upper GI cancers, there are no standard screening recommendations, but those who are at increased risk of developing upper GI cancers, we can consider for endoscopy annually starting at 40 or 50 years.
Well, prostate cancer is also a rising concern in our country. Often misdiagnosed as benign prostatic enlargement. However, when we just do a blood test, we find the PSA values being extremely high, and sometimes patients are diagnosed in advanced stage. So what can we do about finding out prostate cancer on time? Dr. Madhusudan, who is the head of radiation oncology, will discuss this with us.
All men aged 50 to 70 should undergo screening once in every 2 years. A simple blood test called PSA will be done, which will detect or which will say whether someone is having prostate cancer or not. For some men who are at high risk of having prostate cancers, for example, black Americans or somebody with history of prostate cancer in the family, or someone with having their family member diagnosed with breast cancer, prostate cancers, pancreatic cancers or endometrial cancer at their earlier ages, their family members, the men, are also at high risk of getting prostate cancers. In them, there is possibility that they might be having some defective genes which runs in the family. So in those cases where we say that there is an increased risk of prostate cancer, we start little earlier than the average age at about 40 years of age, and we continue up to the 70 years of age. Another important point to mention here is we generally do prostate cancer screening in men with a life expectancy of at least 10 years.
Pediatric cancers are diagnosed each year. They are a rare subset of cancer, however often curable if treated on time. Dr. Tanushri Paul, our pediatric oncologist, will tell us more about them.
Pediatric cancers, like adult cancers, it cannot be prevented because it is not related to environmental or lifestyle factor. However, if we detect early, the treatment is very much curable. So for early detection, there are very few signs which like unexplained fever for more than 2 weeks, unexplained persistent headache or vomiting in a child, or some white eye reflex which often noticed by mother but often ignored by the practitioners. They should be taken care of, or any unexplained lump in any part of the body, abdominal lump, or any bleeding or unexplained anemia. If any child have these symptoms, then they should go to a pediatric oncologist. So there may be an early signs of childhood cancer.
Hematological cancers are a rare group of cancers. However, they are often curable. We talk about leukemias, lymphomas and myelomas. And then of course certain blood disorders. Dr. Nishit, our hematologist, will talk about it.
So as ma'am mentioned, the hematological cancers are curable most of the time. However, where we miss is when the routine investigations are done for a patient, or for general workup, any routine investigation is done, and incidentally you get some variation in your blood parameters. It is absolutely vital to take an opinion of the hematologist, because sometimes from the symptom to the treatment, the duration and the gap has to be extremely less to get a better outcome and expect a better care in future. Early the diagnosis in hematological can greatly alter the treatment and also greatly alter the outcome of the patient's life. Thank you.